Good morning, you all. Good to see you back again. So today I'm going to be talking to you about, will this treatment work for me? So when I say, will this treatment work for me, I mean, is the treatment safe and effective for everyone? So in order to figure out if this is the case, we have to look at something which is known as subgroups. So subgroups are actually a subset of people who are pulled out from a larger group of people, such as different races, ethnicity, age, and sex. In order to test to figure out if the treatments are effective and safe for everyone, we have to perform something known as subgroup analysis. And basically, subgroup analysis looks at whether the treatment is safe and effective for in all subsets of people, because drugs can actually work differently in different subsets of people. They can work differently in women and differently in men and in different races. Okay. So why does that matter to you? Why do we even care about subgroup analysis? Well, one, it improves our understanding of diseases, and when you look at different races, sex, and age. For example, African American women tend to have more aggressive forms of breast cancer, and heart disease actually presents itself differently in women than in men. And elderly actually tend to metabolize drugs a little differently than the rest of the population. So another reason it matters is because this is the only way we actually know that treatments and medical devices are actually safe for everyone, not just a special group or the majority of the population, but for everyone. And typically the challenge with that is women and people of color, as well as the elderly, are typically underrepresented in clinical trials. And unfortunately, we've been taking the one-size-fits-all approach. If it just works in the majority, they feel it will work in the minority, and that's not the case. And we know this approach does not work. Okay. An example of the one-size-fits-all or the one-dose-fits-all not working is through the drug known as Ambien, which the FDA approved to actually treat insomnia. So millions took the drug, and unfortunately, they were involved in car accidents due to drowsiness from the next day because the drug hadn't cleared the system. So, because of the dosage that they have prescribed, and being they didn't actually look at the drug in men and women, the drug actually stayed in women's bodies a lot longer than men. And they discovered this a little too late. So the women, because it stayed in their bodies much longer, they were more likely to drive impaired the next day. So that resulted in a lot of car accidents and caused a lot of tragedies. And due to that, they had to reduce the dosage for women. They actually halved it. So after 20 years after approval, they actually had to halve the dose. So as we can see, one dose doesn't fit all. It doesn't work. It may work for some things, but not for your medications and your medical devices. It's too serious, and it's too much of a risk. Okay? So from this, we learned that one dose does not work for everyone. And the FDA's job is to protect us and make sure that all drugs, treatments, medications, and medical devices are safe and effective for the entire population, not just the majority. So with the case of Ambien, the FDA failed, but hopefully today we can work on making sure they don't fail anymore by being informed patient advocates and letting them know. So what the take-home message from this is that all treatments need to be proven safe and effective for everyone. And in order to do this, we have to study subgroups. As far as the subgroups go, it actually for the federal government, the Department of Health and Human Services, you have to have demographic inclusions or subgroups are required, except for the FDA because their clinical trials are actually funded by the private company. But I definitely understand with today and the personalized medicine approach that it is important that the medicine works for individuals. But to look at a broader scale, we need to make sure we actually test it in the populations that are going to be using the drug, so we don't have any failures on that end. But I understand the personalized medicine approach.
Right.
I definitely do.
Yeah, and let me just clarify that the thing about precision medicine is that it's clear that it's only for certain small groups. The problem with the FDA approval process, the way it is that people assume it's okay for everybody because it's approved for everybody, unless, I mean, sometimes there are drugs that might say, this is for adults between 18 and 50. But usually, much more common, it'll say adults 18 and over, and yet it's never been tested on anybody 70 and older, and in fact doesn't work very well or can be very dangerous for people 70 and older. So I think, Rick, to get to your point, there's no law that says it has to be approved for everybody, but the indication should be specific about who it is safe for and who it's effective.